Hi, my name is Robert G. Schwartz, MD. I'm Chairman of the Board of the American Academy of Thermology. It is from that position that I'll be presenting today's topic, Scientific Medical Thermology in the New Normal. The American Academy of Thermology is a premier organization in North America for the scientific development, healthcare training, and clinical application of medical infrared imaging. Our goal and our mission statement is to promulgate through science, training, medical education, and utilization the use of medical thermology in the medical community. We're a 501c3 nonprofit organization. We write internationally peer-reviewed guidelines for neuromusculoskeletal, breast, oral systemic, and veterinarian medical thermology. Scientific medical thermology in the new normal. Medical thermology is now positioned to become part of mainstream medicine, possibly for the first time and probably more so and with more potential than in the past. We don't call this the Phoenix is rising, but the green shoots are definitely there. Multiple instances and advances in the field of medical thermology have occurred over the last 10 years that truly make it prime time ready for medical thermology and the medical community. There's still much work to be done. However, the foundation is in place and people are taking notice. Some background. Over the last 10 years, high-resolution images have become ubiquitous. We've gone from lower-resolution cameras, even decades ago where we were using liquid crystal, to high-resolution, high-definition images today, consistent with images obtained in other medical formats. Clinical and research protocols have been created. For the first time in the history of the field of medical thermology, internationally peer-reviewed clinical and research protocols, as well as AI protocols for utilization across different disciplines and study types have been developed and agreed upon. Thermal reporting formats now conform with other medical studies. In the past, medical thermology reports were highly individualized and did not most often conform to what other medical reports would look like. The AAT has, through its training programs and mission statement, been able to promulgate reporting formats that make a medical thermology report look more like any other scientific medical report that a medical office might order. DICOM export of radiometric data is now available. This is a new development and for the first time is being brought to the field of medical thermology. Without DICOM, which is an image type format that is used in all hospitals and clinics, medical thermology cannot truly be taken seriously. And differentiation of thermal findings, thermal impressions, and clinical impressions have become the standard of care. For the longest time, individual thermographers would confuse a thermal impression or a clinical impression or a personal opinion with thermal findings. This led to a lot of controversy and discussion among others that were looking at the reports and the data, stating that thermology simply measures temperature, and you can't say that it is measuring or found something different other than temperature. So separating findings from impressions and clinical impressions have become the standard of care. We've worked very hard to promulgate that information and that standard. A summary of some of our accomplishments over the last 10 years include an internationally peer-reviewed medical guidelines. Prior to the AAT writing internationally peer-reviewed guidelines for neuromusculoskeletal, breast, veterinarian, and then oral systemic thermal medical imaging studies, they simply didn't exist. Individuals did their own protocols, they did their own setups, they did their own laboratories. There was no standardization throughout the field. And that made it impossible for people looking from the outside, looking in, to determine whether or not there was any real standardization or formalization from a medical format that could be applied to the industry. These peer-reviewed guidelines help everybody to conform in such a way that gives you enough leeway so they're not a standard that's saying what must be done, but on the other hand, they present guidelines that you must follow within these certain parameters so that everybody can be talking a uniform language and doing uniform type studies. We present annual scientific sessions. For the last 10 years, we put on annual meetings with physicians and technicians, as well as research scientists from across the globe. These scientific sessions have grown in their popularity as well as in their scientific merit each and every year, and have become respected within the medical community and throughout the thermal imaging community. We created an atlas of normals and abnormals. The atlas of normals simply being intended to show individuals what normal studies look like that are interested in the field, and the atlas of abnormals to correlate what abnormal studies compared to traditional medical studies, so that an individual who's used to an MRI, CT, EMG, or laboratory report can understand how to apply this technology with what they already know. There's been an exponential increase in journal citations. We've been told and seen throughout the literature numerous times that as a result of our efforts and the efforts by the International Thermography community, that more people are interested in writing and publishing on thermal imaging than they have in the recent past. And another fantastic accomplishment is the creation of medical residency and education programs that are involving medical thermology into their training programs right from the get-go. Of course, this can only mean that more people are trained in thermal imaging and understand its potential as time goes on. Let's dive a little bit more into each one of these accomplishments. Every 3 years, the AAT reviews one of its internationally peer-reviewed guidelines. Usually, breast and neuromusculoskeletal are done in 1 year, and then oral systemic and veterinarian are due in another year. In the third year, we have time off that we review and intervene and apply new medical technologies and or educational initiatives. This is a major uptaking. Every single year, we have to internationally peer review these guidelines. We accumulate comments, data, updates in the procedures, updates in technologies, innovations that have been published over the last 3 years, and revise our guidelines so as to make the wording better, to make the standardization more understandable, and to make sure that we are up to date with what's going on in the field of medical thermology and medicine at the current time. Quite importantly, the way these guidelines are written follow the standardized format that all medical guidelines are written in, so people in the medical community as well as the Federation of Societies and government agencies that look at medical studies can read these guidelines and understand that this acts, talks, and looks and works just like any other medical study that they may be evaluating. We created an AAT member certification program. This is a member certification program. It does not mean that you are quote-unquote board certified in order to provide medical thermal imaging studies or to read them. It simply means that you've undergone a minimum level of education and training that demonstrates a sincere interest in the field, and that you do know what some of these guidelines and protocols are, and that you're familiar with the proper way of doing a thermal imaging study as well as of interpreting one or reading one if it's just for your own individual cases or clients. A working knowledge of the guidelines is an essential requirement. Candidates must complete the certification qualification course or another accepted course by the AAT. Technicians have to submit studies, and physicians must also submit medical reports about their findings and clinical impressions or thermal impressions of those studies. Performing and interpreting studies within a medical format is an essential characteristic that separates scientific medical thermology from everything else. We have medically based training that simply didn't exist before. We now have course offerings on how to get started in medical thermology. We have numerous people that contact us and ask, how do I get started in this field? We understand the field, but they really just don't know where to start. This is a free set of courses that the AAT now offers, and the AAT even offers a live session as a pre-course to its annual meeting now, helping those to actually get started in creating a thermal imaging lab, what kind of camera and OEM and software to purchase, what are the ancillary supplies that are required, the basics of getting started. We have a free fever detection course for those that were interested in trying to do this because of not only COVID, but because of long-term occupational and or community health reasons. We have 2 segments of this, how to do it right and how to do this if you have to. Maybe cut your budget and do it with not necessarily the best quality assurance on calibration or camera quality, but you still want to try to do something that's reasonable. We've provided you the framework with which you can use this modality to help you to reach that goal. We have the certification qualification courses now online so that they can be taken whenever you want at your own time and your own leisure. And then you can apply after the qualification courses and pre-test and post-test that comes with those courses. Once you pass them, you can apply for a certification, member certification certificate that we will review your studies and your reports. We have an advanced technicians training course for those technicians that are interested in more than just how to take the study properly, but maybe you have a higher educational degree, maybe you're an advanced physical therapist or even an advanced trainer or somebody who's trying to use a modality, this modality to help you determine what restorative therapies might be appropriate, for example, in a sports injury or neuromusculoskeletal domain, or even to help with wellness and other preventive health disorders. So we have an advanced technician course to help you understand, again, the difference between findings and impressions and how you might apply those findings within the realm of your license without actually writing a formal medical report. We have a physician's interpretation medical thermology course to help physicians that want to go beyond just looking at the findings, but have a broader understanding of how those findings apply to their patients and possibly for reading all of the reports, writing the reports, or even reading for others. And we have our annual scientific sessions replayed now online. Ever since COVID, we've been virtual. We will, of course, be progressing to hybrid meetings as it becomes more feasible, and that's planned for example, in 2024. But for the last 3 or 4 years now, we've had virtual meetings, and as a result, have recorded them, put them online, and those replays are now available within our course's website. The scientific sessions have become a mainstay of AAT. Every year we have speakers from around the globe across multiple medical specialties and multiple disciplines, including AI specialists, thermal physicists, forensic specialists, and various medical specialties that might include neuromusculoskeletal, vascular medicine, ophthalmology, vascular disorders, breast, surgical disorders, surgical specialties, and primary care. All of them are providing a different perspective on how they're using thermal imaging within their own medical specialties and fields. They span the globe and have numerous content and topics that are all related in one form or another to something within the AAT guidelines. The Atlas of Normals is intended to show the beginner what normal studies look like. If you're just looking at the thermal imaging field, you may never have even seen a thermal imaging study. You don't know what a thermal imaging protocol looks like. You don't know what a normal study looks like. You don't understand that your body's expected to equilibrate under cold stress. You don't understand what abnormal temperature finding would be. And you don't understand that a microbolometer or a thermal imaging detector is not the same thing as just any standard camera. The Atlas of Normals is to help you understand what normal studies would look like. And it's free to any member or non-member. The Atlas of Abnormals, however, we give a little bit of sound bites to people that are not members, but the rest of the Atlas of Abnormals is a member benefit of the AAT. In this case, we give you an opportunity to publish and submit your thermal studies and then show them along with collaborative other traditional medical studies such as CT, MRI, CAT scan, laboratory, your office notes, your physical exam, things that normally would collaborate and make a differential diagnosis, and how you use the thermal imaging either to create a thermal signature that may actually be pathognomonic for a particular condition, or at a minimum an extension of your physical exam that changed the clinical course of care for individual patients. There are now more medical publications and recent scientific organizations that are recognizing medical thermal imaging than any time in the recent past. Over the last decade, the number of annual publications has increased by a factor of 10 across all types of medical publications, including citations just simply listed in PubMed. New textbooks, journal articles, and chapters within prominent medical publications are now available. I point out the Elsevier series of PM&R Secrets. Elsevier is a well-known medical publisher, and they create a series book of medical specialty across medical specialties that helps residents in their training and their board certification and their education to know what are the important salient points that they need to be prepared for their board examinations. PM&R Secrets is now a chapter on both vascular medicine in PM&R and in medical thermology and autonomic disorders, both of which talk about medical thermology as a role for the physiatrist preparing for his board examinations and how to utilize this modality within his own practice. This is a very important training tool that has now become part of the education and training process for PM&R residents across the United States and hopefully the globe. Medical record reporting is an essential change that has occurred throughout the promulgation of scientific medical thermology by the AAT in the last 10 years. We've talked about it before, we'll talk about it again, I'm talking about it now. You must differentiate between thermal findings, thermal impressions, and clinical impressions in order for thermal imaging to take its place alongside other medical imaging studies. A radiologist does not read that there's degenerative disc disease at L5-S1 and then conclude that the MRI or X-ray report concludes that this person needs surgery. That's a clinical impression. Nor does he conclude that this person has sciatica. That's a clinical impression that cannot be created just based on the radiologic report. Instead, he says there's degenerative disc disease at L5-S1 or disc-based narrowing. Clinical correlation is advised. Medical thermology is no different. Thermology measures temperature. Temperature is a finding. Sometimes those findings come together in a constellation of findings that they have a thermal signature. For neuromusculoskeletal, there are several. For example, thoracic outlet, CRPS, or even mixed headaches like Barré-Liu are examples. When you see a certain constellation of findings, they're pathic mnemonic for a certain kind of medical condition. For the most part, however, there aren't true thermal signatures beyond that, with the exception of what we call TH scores for breast, and more recently, artificial intelligence-induced and machine learning-induced risk scores for breast thermal findings. Clinical impressions range from anything from estrogen dominance to a person needs a liver flush to we believe a certain musculoskeletal tendon or ligament or muscle or structure is generating a sympathetic nerve fiber response. Those require a history and physical examination to make statements such as that. Thermal findings don't tell you that. It's a clinical history and physical. It's an examination, extension of physical examination that allows the clinician to use thermal imaging to give you a new clinical impression or to make use of that to formulate a clinical impression. Clearly, as we continue along with AI and machine learning, we'll be looking for new thermal signatures to come to the forefront. Software as a medical device is a big topic, and in many ways it's actually helped the field of thermal imaging. Several years ago now, the FDA has regulated that any medical device or software that make claims that go beyond findings will be subject to the same regulations as a drug in order to be approved by the FDA. What that means is that an OEM, a manufacturer of software or hardware, really can't make claims beyond findings. A thermal imaging device can only detect temperature, or at least detects infrared imaging that's displayed in a temperature format. To say anything more than that would be a requirement from them, by the FDA, to go ahead and submit pre-market notification and other formal drug application. It's cost prohibitive, and as continued new applications come about, it doesn't make any sense. On the other hand, organizations such as the AAT, which do not have any financial interest in either medical software or hardware from manufacturers, but is solely interested in the promulgation, education, and training of medical thermology, can evaluate those findings and can make statements about clinical applications as well as thermal signatures. So by writing again reports with thermal findings only and learning the difference with thermal signatures and clinical impressions, attending the AAT scientific sessions, reading the guidelines, reading the new scientific medical publications, you'll become part of a new community that is growing and only going to continue to grow, in our opinion, as this field broadens and regulation continues to make people do this in a truly medical scientific way, or just be relegated to what we call everything else. Another first that's been created by the AAT is export and DICOM. AAT helped create a DICOM format and is working with OEMs for hardware and software so that a technician or an interpreting physician can take any thermal imaging study, export it in what's called a DICOM format. This is the format that's used by hospitals and clinics worldwide to export their medical imaging studies, which they then store in something called a PACS system. This is basically a storage system where you might, for example, see a radiologist or a radiology department exports an X-ray or an MRI or a CAT scan, angiogram, a duplex ultrasound study. It doesn't really matter what it is, and either that interpreting physician on site or even in a different site, or even sometimes an international site, because it's DICOM, they're able to pick this study up off the PACS system, interpret it, and give you your report. That wasn't available in thermal imaging until 2022/23, and we're still developing it, and we're still getting new software and hardware vendors that are making their products DICOM ready and DICOM export usable. These do exist now on the AAT website. You can find them within our marketplace, and I'll touch more on that. The reason this matters is because most hospitals, medical universities, and other facilities won't even consider utilizing medical thermology in a medical way if there is no such thing as a DICOM format, because that's the way they store everything else. Equally important, by this DICOM format, we're also retaining or preserving radiometric data so that information can be looked at later, both from a machine learning, AI perspective, and from an interpreting perspective, in order to write proper thermal reports and create new thermal signatures. That means there's interoperability. When the Artificial Intelligence Infrared Alliance was created, it was to form DICOM-ready protocols that, with everyone adopted and used in the same way, we could then apply artificial intelligence and machine learning to that data in a large number, broad-based way to create new thermal signatures and to help differentiate clinical impressions from thermal findings that are AI generated. At the same time, technicians and interpreting physicians, because of the DICOM format, are going to be able to read and share files back and forth without being dependent upon a certain kind of platform that they were maybe locked into in the past because of their camera or software manufacturer. That gives more people more options for education, training, interpretation, and promulgation for the field. In order to help facilitate that, the AAT also created the Infrared Imaging Reporting Resource. This is basically a marketplace. The AAT has no financial interest in this whatsoever. It is simply a membership of benefit where we allow technicians and physicians that are following AAT guidelines and protocols and the AIR Alliance AI protocols to exchange their images and exchange their files for interpretation, training, and promulgation of the field, as well as report generation. But what we've also done is we've added on there several new platforms. These are vendors, hardware and software vendors that are utilizing or make it so their software can be utilized to take the images within AAT protocols with DICOM radiometric preserved format export. Many times these formats are simply part of the firmware in the hardware itself. Other times additional perks are created, or shall we say, enhancements are put into the software to help you with your interpretation and analysis, and as well as exchange of reporting and of data. We encourage all members, of course, to go onto the marketplace, to look at these platforms, and then to submit their own studies to the AAT's PACS system, so that part of the being a member of the marketplace from the OEM side of it is that we'll get scrubbed demographically studies so that we can again utilize this within the AIR Alliance and create new thermal signatures, not only based on individual platforms from OEMs and software and hardware OEMs, but from individual practices and institutions that want their studies to be part of an internationally peer-reviewed artificial intelligence and or machine learning process. The AIR Alliance founding members include the American Academy of Thermology, AAT, the Korean Society of Thermology, and the Data Center for Korean Body Temperature. This is a huge data center that Dr. Zhang has been medical director of since the SARS pandemic, where they started recording in Korea as a national health initiative, human body temperature measurements for research and research protocols and studies. Of course, the Abertherm community, headed by Dr. Marcos Briaski, in affiliation with Sao Paulo Medical School, also has a very large and international presence in the field of medical thermology. We welcome all members or all interested parties in participating in the Alliance, but this is the founding members that help create the initial protocols and the standardization that we hope others to participate in, will participate in, and will take their input, of course, and make modifications in thermal signatures and protocols in AI implementation as time goes forward. A major advancement in the last 10 years for medical thermology has been the incorporation of the study into higher medical education. Without medical thermology being taught by residents, for residents, by medical residency programs, you're simply not going to get the field to grow within the medical community the same way that it would otherwise. Scientific medical thermology is now becoming accepted as an extension of the physical exam, and largely as a result of all the things we've just talked about. The medical community views more and more medical thermology as a medical tool that can be used in a clinical setting and that makes perfect sense for them to incorporate within their medical practices. Initial inroads include neuromusculoskeletal practices, vascular medicine, oral systemic practices, and of course community health applications. Future growth and development look strong for this field of scientific medical thermology. Thermal imaging is an excellent candidate for machine learning and AI application. In fact, it may be one of the first that AI actually has a major impact on, and we have other people that are working with us that are AI specialists that see thermal imaging as the digital form to create this AI medical framework to really be a test format, to be a case that it can promulgate AI applications, and as a result has gotten quite a bit of interest. The creation of DICOM, the creation of internationally approved protocols, the creation of standardization and reporting, the creation of internationally peer-reviewed guidelines. All of these things make AI and thermal imaging a perfect marriage. As this grows, we have no doubt that there will be new thermal signatures, and relevant thermal findings will lead to greater medical adoption. So in conclusion, over the last decade, scientific medical thermology has changed dramatically. So much so that the AAT has adopted a new impact statement. Scientific medical thermology, saving lives in the new normal. We hope you'll hear this more, we hope you'll promulgate it more, and we hope that people will start paying attention to it more as medical thermology plays a more and more important role as time goes forward within the medical community. We welcome the renewed interest and stand ready to help those who want to promulgate the field. Please feel free to log on to the AAT. Please feel free to join, become a member, check out our marketplace, to make use of the guidelines, to offer papers for submission for our Atlas of Abnormals, or to participate in our annual scientific sessions, or to simply help create more online training courses and promulgate the field through participating in the advancement of this exciting technology that's in the growth spurt that we're looking forward to in the near future. Thank you so much.